Hello and welcome back. Today we're going to talk about the fertility awareness method. So this is often used as an alternative to family planning if you do not want to use hormonal birth control or copper IUD or anything of that nature. The concept of this method is to track and understand your cycle better. And I would say that you should still be doing this even if you are not in a phase of family planning. A lot of the times I think we hear the term family planning and assume that you should be doing this in order to plan your family, but it actually just helps you better understand how your body works, how it functions, and how your cycle is specific to you so you can best support it. We've talked about cycle syncing in the past and how that's not necessary, but if you understand how your cycle works by tracking it, paying close attention, and understanding the symptoms that show, it can really help you be your healthiest and smartest, most attuned version of yourself. So the concept is fairly simple. There are apps that can help you. I've personally used Natural Cycles in the past. I know I've had other clients who have used apps like Flow or even Apple Health. The first thing to track and understand is the cycle length. And this is both the entire cycle throughout the month and your menstrual cycle in particular. So days of bleed, as well as day one of bleed to the last day before you restart the bleed, that both of those can give you a really good insight. Now, if we're talking about what to look for, we want it to be consistent and we want it to be within what is typically known as a regular range, which is about 24 days to 40 days. Now, those numbers can vary depending on where you look, but those are pretty commonly known as regular cycles, right? So it can be anywhere from 24 to 40 days. However, we want it to be consistent. So if you are having a 24-day cycle and then a 40-day cycle and then a 30-day cycle, that does not give us that regularity. So we want it to be both normal in length and also consistent in length. Menstrual cycle is pretty similar. We want to kind of have anywhere from a 3 to maybe 7 day bleed, but once again, we want it to be fairly consistent. Consistency ensures that the body is working in a very routine manner. In addition to those two pieces of information, we want to understand what the menstrual cycle actually looks like for you. What are the symptoms like? Are you having heavy bleeding, heavy cramping, extremely painful cramping, a lot of acne flare-ups, gut flare-ups, anything like that? Record all of that data during your cycle. Is day 1 the worst, day 2, day 7, whatever it might be? That is important information because while cramping and certain symptoms are normal during a cycle, especially in some cycles when we're more stressed, if we were having really severe periods, that also lets us know there might be room for improvement hormonally. Additional things to track that go a little bit more in depth. So basal body temperature is a really popular thing to track when it comes to your cycle and fertility. The reason for this is that when we have ovulation occur, receive a spike in progesterone. That spike in progesterone helps us get all of the benefits of progesterone and also balances out our estrogen. What happens when we have that spike in progesterone is our basal body temperature, meaning that when we first wake up before we have a lot of movement in our system, will spike by about a half a degree. So it is a fairly low spike, but it should spike and maintain. And that shows us that not only have we ovulated, but we are having a sustained release of progesterone, which is really beneficial for health. This is why it's really helpful to track these things even when you're not actively trying for a family, because we want the benefits of progesterone whether we want to get pregnant right now or not. A really great way to do that would be get a temperature that you put under the tongue, put it right next to your bed, and before you stand up in the morning, take your temperature and write it down. You can enter it into the app or you can track these things with a pad and paper. They both will work. You're looking for that half a degree spike in temperature and to maintain around ovulation, which is typically days 14 and 15, depending on cycle length, through the end of your cycle. Other things to track include mucus. We won't get too in depth there, but you kind of get the idea. We really want to gain that story and that idea of consistency within a cycle. Now, if you notice that there are irregularities, this is a great time to reach out to a coach or a provider to ask if there are tests to maybe get or basic foundational tenets that you can meet to help get your cycle more regular. Hopefully this was helpful. If you have questions as if you can use this on birth control, if this is actually a valuable thing to be doing regardless of if you're family planning and if you're thinking about getting off birth control, but you are worried about the actual birth control aspect, drop questions. Let us know what we can do more in depth to educate you on this. But I have many clients who use this method. And like I said, even if you're not family planning, it helps you truly understand what your body is doing, what your cycle is like, and just lets you get to know each other or yourself a little bit more and how to best support you in particular.